HHS Secretary Robert F. Kennedy Jr. made Make America Healthy Again Commission just released its highly anticipated report on the state of America's health, and it comes with a warning that the rate of chronic disease is rapidly accelerating, especially to young America's children. This is Outnumbered. I'm Harris Faulkner, here with my co-host Kayleigh McEnany. Also joining us today, Marie Harf, Fox News contributor, former State Department spokesperson under President Obama, and Kayleigh McGee-White, Independent Women's Features Editor-in-Chief and Journalism Fellow for the Steamboat Institute. Dr. Mark Siegel, Fox News Senior Medical Analyst, Professor of Medicine at NYU Langone Health, and host of Nation Under Lockdown on Fox Nation. So we'll lean on him big time for this news. Let's begin with senior White House correspondent Peter Doocy with more on the MAHA report. Peter.
Harris, it's 69 pages long, and it lays out the roadmap that RFK Jr. thinks federal agencies can use to reduce chronic childhood illnesses in this country. And the top of the list of problems is a poor diet. This report found that up to 70% of food that most children consume contains ultra-processed ingredients.
I think everybody wants to prioritize the ultra-processed food crisis and try to reduce our reliance on ultra-processed food and try to improve the quality of the food, improve the nutrient density of our food. Little children, as they grow up, require micronutrients in their food for brain growth.
Going through the other main bullet points of this report, chemical exposures are a concern, with the authors ordering a study on pesticides by next year, a lack of physical activity and chronic stress, basically kids playing less outside and more on their screens inside, and then over-medicalization, they say. The authors think kids in this country are being over-prescribed drugs they don't need.
A generational accomplishment of the Trump administration will be reversing the childhood chronic disease crisis. It is common sense that Americans aren't chronically sick at high rates because of an absence of drugs.
So it's the EPA, it's the Agriculture Department, it's HHS, all looking at this. There's going to be an event here in the 3 p.m. hour laying out the next 100 days of steps. Harris.
Peter, thank you very much. It's right on time, too, because we were told when you and I were together like 15 minutes ago it was coming. Appreciate you. Thank you. Kayleigh, I know you've got a copy of it. We're going to lean hard on Dr. Siegel, so let's go around the couch and each ask a question. You want to go first?
Yeah, absolutely. Look, this is an interesting report. Dr. Siegel, I love citations. I'm a weirdo. There's 522 citations in here. Haven't been able to read through them all. But what I find so fascinating are there's so many problems that I didn't really give much consideration to. The ultra-processed food is really interesting. I would also note the over-medication, I should say. This part, interesting to me. 1,400% is the increase of antidepressant prescriptions among young people in this country over about 2 decades. 250% increase in ADHD prescriptions between 2006 and 2016. And it makes you wonder, the increase of depression among young people in this country and this massive increase in medication, something seems grievously wrong.
And the data in this report is staggering and really important. And I'd only add one more statistic that was so sobering, that 3,000 teens considered suicide in 2023, right there in the report. It's all tied together, right? They focus on the obesity crisis, that there's 3 times as many kids that are obese now as were in the 1970s. But obesity leads to sedentary behavior, which leads to depression. Then you get over-medicated. Somebody puts you on an antidepressant. Then you're on a stimulant you may not need. The amount of stimulants are up 3 times also over the last decade and a half. All of it tied together. 75% of kids don't qualify for the military now, largely because of obesity. All of this in the report. You know what got me the most, Kayleigh? When I was in medical school and I was studying a 5-year-old, we came up with this term called a fatty streak. I said, what's that? It turns out that the heart arteries feeding the heart, that are the tiniest in the body, are already starting to fill with fat in a 5-year-old. The time to fight this crisis is now. They're 100% right.
All right, so I want to start with a question about food, because if you're going to tell people what's in their food, we've already been doing that. What I understand that the Secretary Kennedy wants to do is to tell you what those things actually do to the body. That's what's different. So when I read the nutritional value, I'm not looking for percentages anymore. Now I want some real information, like, well, what is that dye that's in there? And he's making us sensitive to that. How does that help the situation, though, when people are going to eat what they want to eat?
Well, we can't take away with people eating what they want to eat, but there's big lobbies in Congress that are lobbying for food that's on the store shelves, and one of the reasons they want it there is because it lasts longer, so it's more of a profit. And so they're already making a dent in this by fighting the food dyes. They're already moving in that direction.
And you like that in particular?
I like it a lot, and I like.
Is it in everything, food dyes?
It's in everything, and 9 of these dyes are now being taken out, but they're really unhealthy. And you know, one of the ways that he gets stage weight in all of this, stage weight, is by comparing us to other countries. You know, you go to Europe and it's not in the food, or you go to Europe and you eat pasta and you don't gain weight. And so we have to at least be as sensitive to what's in our food as other industrialized countries are, and we're not. We're not. And the cost of all of this, by the way, other thing the report focused on that I like is the word sick care system, because it costs us a fortune to take care of people when they're sick because they're eating this crap.
Right. Kayla, you have a question?
Yeah, you know, I never would have considered myself crunchy until I found out that I was going to be a mom. And now, like most moms and soon-to-be moms, I'm very concerned about what I'm putting in my own body, what my child is going to one day consume. And I do think that information and choice is so important here, because obviously the European Union, which gains a lot of comparison in this issue, you know, they have very strict regulations. And I worry about replicating some of those and becoming a little bit nanny state-ish on this. Yet there are some things that they do right. Whereas, you know, on certain products where they allow food dyes, where they allow certain ingredients, they require those producers to actually notify customers on a warning label before they're consuming that product so that they're at least aware. Is that something that you think the U.S. could replicate?
Yes, I do, and I think the U.S. is moving in that direction. But more to the point Harris was making, we still need free choice to be in here. So another thing this report focuses on is the center is going to be the farmer again. If we can go back to the farmer and what they're growing and maybe incentivize, rather than regulate, how about incentivize them to grow healthier food? And if the food is grown healthier, can we get it to the table, food to table, rather than through some intermediary who makes it to the point where we can't even recognize where it came from?
Or afford it.
Or afford it.
And that would be great for our farmers, too, because they're at the heart of all of this. They're the superheroes, and they know a lot more if we'll just listen to them.
And not pay them not to grow, right?
Right,
like
exactly.
Has been a
Well,
tradition.
and on that point, Dr. Siegel, what do you make of the report's findings on pesticides? I know that that's been a pushback from the farming lobby in particular.
Well, I like the combination. See, that's another thing I like about this report. What I'm emphasizing is how it's all together. It's not just what's in your food, it's what's in your environment. And I think you know, talking about pregnancy, for sure, pesticides and how that affects fetuses in the womb is a very disturbing question.
Marie?
I want to keep talking about this nutrition issue because, you know, I'm old enough to remember when Michelle Obama tried to do some of this. There was a lot of criticism of her trying to get kids to eat healthier. So I'm glad to see that being a focus of this, Dr. Siegel. My question for you is, it's hard for me not to read this in combination with this bill that passed through the House last night that cuts $300 billion from SNAP benefits, nutritional benefits that poor kids use to get food. Food aid for poor kids who can't afford it another way. How do we help get healthier food to kids if at the same time Congress is cutting the exact funding that helps poor kids get that food?
That's a really, really fair question, Marie. I think it has to go on at the state level where some laws about SNAP are passing and start to incentivize alternatives in the food rather than the same rubbery pizza in schools or the same unhealthy French fries. What are you going to replace it with? I wrote a piece about that in Stat. What are we going to replace it with? Because food's an addiction. What are you addicted to? If you're addicted to bad food, how can we get healthier food in there? In Arkansas, they're saying, let's put rotisserie chicken on SNAP. I like that, although they say there's plenty of fat in that. It's certainly healthier than something that looks like it came from the moon.
Right. Real quickly, baby formula, because we have a couple of moms in waiting, as I like to call you guys. Just, is there any ingredient in baby formula that has you worried at all? Because that has been a replacement for years and years, and some children have to have it. Some moms depend on it.
No, I think that baby formula has those exact forever chemicals in there that I'm worried about. Absolutely. It has to be, again, looked at from the beginning. How's it made?
Okay. All right. So we're looking at everything. And we'll move on. Thank you. I know you were in the hot seat there. Appreciate it.
Hey everyone, I'm Emily Campagno. Catch me and my co-hosts Harris Faulkner and Kaylee McEnany on Outnumbered every weekday at 12 p.m. Eastern, or set your DVR. Also, don't forget to subscribe to the Fox News YouTube page for daily highlights.